today we are going to discuss the blood supply of the brain. And we already know it's a basic organization. What do you know about the blood supply of the brain? I think you had an early lecture about the blood-brain barrier.
And you have this they took the types of barriers and the things.
Yes, the level of the barrier.
Yeah, only.
Anything about
Nothing
the
else.
Okay. Okay, we have two lectures about the blood supply. We are going to cover the arterial supply now. In the afternoon, we will cover the venous drainage and the lesions, the problems of blood vessels. Bismillah ar-Rahman ar-Rahim. The session objectives are the following. So, upon completion of today's session, you are expected to be able to describe the features of cerebral circulation, to discuss the formation and significance of something called the circle of Willis or Willy, the S is silent, and then you are expected to be able to explain the concept of watershed areas. The highest watershed area, I want you now to open your ears. When we come to that part, you listen carefully. Three main objectives. Okay. Look at this young man. It's a hemiplegic gait. It's a hemiplegic gait. Why am I starting with hemiplegic gait? Because of this question. What is the commonest cause of neurological disorders? Yeah, is it congenital defects or is it
Vascular.
vascular? The major cause, the commonest cause of neurological disorders are vascular. Before I start, some of you mentioned cerebrovascular accidents and some of you mentioned stroke. Are they the same?
What's the question?
Cerebrovascular accident, CVA, a term widely used. And there is a stroke, a term which is also widely used. Let us clear this terminology issue before we start discussing the blood supply. Yes?
Stroke is due to ischemia, so there's a blockage of an artery,
Okay.
and cerebrovascular accident could lead to hemorrhage, and that causes increased intracranial pressure.
Is blockage an accident or not an accident?
Blockage. Can be an accident.
It is an accident. It is something abnormal happening. So any accident in the blood vessel is a cerebral circulation is a cerebrovascular accident, whether it's a blockage or a rupture. Whether it's a cerebrovascular accident. What about stroke? Stroke is the result of the accident. What happens? This person has a stroke. What do you mean? There is damage, there is function here or there. This is a stroke. The accident, what caused this stroke, is an accident in the cerebral circulation. So when you use them, try to be precise. If you are talking about the accident, the pathology, the pathophysiology, you say cerebrovascular accident. When you are talking about the condition, the disease, then you say it's a stroke. The patient came with a stroke. Okay, like this one. As you can see, there is a little blood here and there. The blood is there. Okay. Another important question relevant to what we are talking about. How are neurological disorders usually diagnosed? I just talked to you a little bit about something that you said there is this. I showed you half a minute of a video and you said hemiplegic gait. This is hemiplegia. So neurological disorders are mostly diagnosed history and physical exam. Investigations are only done to confirm, to study the extent of the disease. Confirm and study the extent. How big is it? The magnitude of the effect of the disease on the body. You don't use them to actually diagnose. They are very clear. To be able to diagnose through history and physical examination, you need to understand. And to be able to understand, you need background knowledge. So, knowing about the blood supply of the brain is very important, essential. You can, by knowing which artery supplies which area of the brain, then you will be able to diagnose very, very quickly without the need for investigation. But you do the investigations to confirm and to study the extent and magnitude of the effect. Now, this is why we need to study the blood supply of the brain, and we study it very carefully. Now, it's called the blood supply of the brain. It's also called the cerebral circulation. How many circulations do we have? With the title circulation. We have portal circulation.
I think it's
This is all about cerebral circulation. Huh? Let us start with the systemic circulation. The systemic, the pulmonary, the portal, the cerebral, and the coronary. These are the known circulations. So this is also called the cerebral circulation. And it is made of two internal carotid arteries and two vertebral arteries. This circulation. Now, the internal carotid, if we start describing it, is a branch of the common carotid. And we need a little bit of information around that branching or division of the common carotid. It divides into two, external and internal, and there is a dilatation of that junction, mostly towards the internal carotid. It is called the carotid sinus. How important is this carotid sinus?
It has bioreceptors.
It has baroreceptors and chemoreceptors. Baroreceptors in the wall, aren't they? Inside the wall. What about chemoreceptors? Are they in the wall or where are they? There are some outpocketings from the sinus, pockets outside, and these are bodies. We have carotid bodies and we have aortic bodies. Inside, because you need, when the blood is going, some of it will go into that outpocket to stay for a little while to be analyzed. So if it is just running by, it will, the chemistry of the blood will not be detected. You need some place where the blood remains for a little while before this chemistry is detected. So there are these outpocketings which are called the carotid bodies and aortic bodies. So we have aortic sinus and carotid sinus, and we have aortic bodies and carotid bodies. And the sinuses are for baroreceptors and the bodies are for chemoreception. So it starts there from that dilatation, that sinus, and has a tortuous course. And it doesn't go straight through an opening. And this is very important, this tortuous course. Why do you think it's important? It has got 6 pins.
the movement,
Yeah?
during movement of minute.
1. When you move your head, there is some flexibility. Thank you. What else? The heart is here, and the head is here, the brain is here, very close. And we would like to control the blood pressure. Yes. So if it goes through veins, the blood pressure drops during this journey. The blood pressure drops during this journey. So this is also very important. By the way, you studied anything about circulation as far as circulation, the cerebral circulation, physiologically speaking. I mean, there is a very important issue discussed in physiology, which is the balance inside the brain. The cranium has got three components inside the cranium: brain tissue, CSF, and blood. And the balance between these three is very important because the brain tissue doesn't need to be compressed by either the CSF nor the blood. So there is balance. If there is a little bit more CSF, there is a little bit less blood so that this balance is maintained. And also, the veins do not have valves, so blood can flow in either direction to maintain that. And the blood vessels, the arterial part, they have something called autoregulation, physiologically speaking. They are autoregulated so that to maintain blood pressure and stable blood pressure inside the brain so that we do not get compression of the brain tissue. So this balance is very important. فإن reason this torsion force with 6 veins is very important for the maintenance of the blood pressure.
Did you mention that the veins has no valves
Yes.
in the brain?
Yes. So blood can flow this way and this way.
Why would the blood flow in this way?
The sinuses.
The sinuses and even the internal carotid, the blood vessels here do not have valves. Blood can flow this way and the other way.
Why would we
Also, yeah, because we need blood to flow back if we need some more blood. Actually, there's something else why we don't have veins in, we don't have valves in the vessels of the head. Because we need them here because when the blood goes up, we don't want it to come back and dilate the veins and cause problems. And actually, when we have problems with these valves, venous valves, patients get varicose disease because blood goes back and dilates the veins. But here, blood flows with gravity. It's very difficult for it to go back because it cannot go back against that. This is the other reason we don't have it. Okay, these 6 veins, halas, we finished with it. Now, the part inside the cranium, which is many veins, is known as the carotid siphon. You know the siphon. In the ocean basin, the water is not drained directly down. It drains through a siphon because they need the water to stagnate a little bit so that deposits are deposited inside the siphon, whatever. So that's, they call it the carotid siphon because it looks like the siphon used in bathrooms and so on. So there is carotid siphon where it looks like the siphon. This is the siphon, it looks like it. And it has got these 6 bends. First bend, second bend, fourth bend, these bends like a siphon. And in radiograph you can see the siphon with the different parts, the cavernous part, the serum part, the petrous part, the different parts, the cervical part and so on. This is the carotid siphon. Now, there is another important point I mentioned it earlier. It is surrounded by the internal carotid sympathetic plexus. Remember I asked you, do we have branches of the sympathetic chain? Then you pause, I told you, yes, there are many, but there are 2 to be exact or more. But there is one at the end from the superior cervical ganglia that is called the carotid nerve. And this breaks around the common carotid and then makes common carotid sympathetic plexus. And then this divides into 2. One goes with the internal carotid and passes up, supplying sympathetic supply to the head. Sympathetic supply to the head from this internal or common carotid plexus. Sympathetic plexus. So the sympathetic plexus comes from this sympathetic supply of the head comes from this plexus. And it surrounds the vessel. If we have problems in the vessel, atherosclerosis, it might get damaged and then we have syndromes related to the damaged internal carotid sympathetic plexus. You need to know this piece of information. It gives one branch before it completely enters the cranium, and the branch is the ophthalmic to start. Then it gives an anterior choroidal, and it gives a posterior communicating. So it has got an ophthalmic, an anterior choroidal artery, and a posterior communicating branch. Then it divides into two. It bifurcates into a middle and anterior cerebral arteries. خلاص؟ إذا عنده 3 branches and a bifurcation. Ophthalmic معروف goes into for the eyeball. And then anterior choroidal plexus, and then we have a posterior communicating. And this one communicates with the posterior cerebral artery, a division of the basilar artery. We will know about that a little bit. But it has got 3 branches and a bifurcation. This is the plexus surrounding it. This is the superior ganglion, superior sympathetic ganglion, and then it gives carotid nerve, and then a plexus surrounding the internal carotid artery. Now, we mentioned it bifurcates into 2, anterior and middle cerebral. The anterior cerebral passes between the medial surfaces supplying the surface, but not the whole of the surface. We need to mention this right now. It supplies the medial surface of the cerebral hemisphere, but not the posterior part, not the occipital. The occipital part is supplied by another artery, but this artery supplies the medial surface. And then it gives one, this is, by the way, this is the anterior cerebral. As we are done with the internal carotid. This is the anterior cerebral. It has got a branch called the recurrent artery of Hubner. أو اسمه the medial striate, or one of the medial striate arteries. Striate, what does it ring a bell? Where is this going? Huh? The middle. Supply the corpus striatum. The corpus striatum is supplied by medial and lateral striate arteries. One of the medial is the recurrent artery of Hubner. It comes directly from the anterior cerebral artery. Now, this recurrent artery of Hubner passes to the corpus striatum through the surface. It breaks into branches, and then the branches enter through the surface. If you remove the vessel, you will find holes, and this is called the anterior perforated substance. And if you look at the anterior surface of the brain, you will see perforations. These perforations are for striate arteries entering the substance of the brain to supply the corpus striatum and the surrounding anterior limb of the internal capsule. Now, we have 2 anterior cerebral arteries going like that, one on the right side, one on the left. These are connected by an anterior communicating artery. Have we heard this term communicating before? Just 2 minutes ago. There is a posterior communicating branch of the internal carotid. So we have anterior communicating branch, and we have 2 posterior communicating branches from each of the 2 internal carotid arteries. Now, this is the internal cerebral artery, anterior cerebral artery on the medial surface, and as you can see, up to the parieto-occipital, because the parieto-occipital itself comes from the posterior cerebral. So only these parts are supplied by the internal carotid, but not the occipital, and of course not the temporal. These 2 are supplied by the posterior cerebral. Now, one important point you need to notice, look at the branches. They actually supply the medial surface, but they hook around the border to the superolateral surface. So they go also a little bit to the superolateral surface. Now, the medial, on the other hand, I need to stop before I describe it in detail to mention some important facts. The medial cerebral supplies the superolateral surface, and superolateral surface of both, not only the frontal and parietal, but also the temporal, the superolateral surface. As you know, the superolateral surface is the largest part of the cortex, and it contains most of the important functional areas, all of which are supplied by the medial cerebral artery. A problem in the medial cerebral artery is a problem, a real problem, because it supplies most of the superolateral surface. But it passes into the lateral sulcus in the depths of the lateral fissure, sorry, not sulcus, lateral fissure, lying on the insula, because it's in the depths of the artery. But the branches come out and supply the superolateral surface. Now, we will come back to that. Anterior choroidal artery, which is a branch of the internal carotid, supplies the choroid planes. As I mentioned, choroid planes, mainly the lateral, in the lateral, and I mentioned earlier, the lateral extends through the interventricular foramen to become the choroid plexus of the third. So both of these are supplied by this anterior choroidal artery. But it also supplies the optic tract and base of the internal capsule. Now, this is internal carotid. Has got an anterior cerebral and an anterior choroidal, and we describe both. Now we have the posterior, the vertebral artery. We have two vertebral arteries. Now, the two vertebral arteries form a larger artery called the basilar artery. And this basilar artery lies on the anterior surface of the pons. Sorry, this was supposed to come earlier, but this is the medial cerebral artery. It's in the lateral fissure, inside the lateral fissure. Now the lateral fissure is open, it lies on the insula, but the branches come out, and as you can see, they supply most of the superolateral surface. If we just bring this one, I just want to bring this one to show you that it just borders the parieto-occipital sulcus. So the occipital is not supplied by it, neither by the anterior nor by the medial. The whole of the occipital is supplied by the posterior cerebral artery. The other point I would like to mention, I've shown you the anterior cerebral, the branches of which come on the superior surface. As you can see, there is a strip which is not supplied by the medial, it's supplied by the anterior branches of the anterior cerebral artery coming from the other side, this area. And this is, later on I'm going to mention it very clearly, this, one of the objectives is to know about what is known as the watershed area. Yes?
What are the middle cerebral arteries?
Huh?
The middle cerebral artery. And the anterior cerebral artery.
Huh?
The anterior cerebral artery will supply the superior lateral surface.
No. The middle supplies, this is the middle, it supplies the superolateral surface. But the superior part is supplied by the anterior.
So only the superior part is
Supplied by the anterior. But it supplies the medial. But the arteries hook and supply the superior part.
cerebral artery, they supply the medial side
And the superior part of the superolateral.
superior lateral, the whole lateral.
The lateral surface is by the medial cerebral.
Thank you.
So the basilar artery supplies branches, اسمهم circumferential arteries. Circumferential means they go around. Because it's the anterior surface of the pons, and they branch and they hook around the whole brain stem, supplying the brain stem. So circumferential arteries, and they supply the brain stem and the cerebellum. This is the basilar artery. Now, minhum, some of them are the superior and inferior, and the inferior, anterior and posterior. So we have superior, then we have inferior, anterior, inferior, and posterior, inferior, cerebellar artery. This supplies the cerebellum. And then we have pontine. pontine circumferential, but pontine penetrating. Some of them come from the inner surface of the basilar artery and penetrate into the pons supplying pontine nuclei. So these are penetrating branches to the nuclei of the cranial nerves and the pons and pontine nuclei and cranial nerve nuclei. اسمهم penetrating branches. Now, the basilar, formed by two vertebral arteries, becomes the basilar, if its branches, cerebellum and brainstem. Then it divides into two posterior cerebral arteries. Now, the posterior cerebral arteries, we already saw them. They supply the inferior surfaces of the hemisphere, inferior surface, including medial, temporal, and the whole of the occipital. Now, these are the two vertebral arteries. They join to make the basilar. Basilar gives it its branches, circumferential and penetrating, and then divides into, including the cerebellar arteries, and then it breaks into two posterior cerebral arteries. And since we already have this is a posterior communicating, which communicates between the internal carotid and the posterior cerebral arteries. These are the two anterior cerebral arteries, and they are joined by an anterior communicating artery. This is the side view. You can see the circumferential branches. You can see the cerebellar branches of the basilar. This is the basilar. This is one of the vertebral arteries. This is an inferior cerebellar. This is superior cerebellar. And the inferior cerebellar are two. One of them is anterior, one of them is posterior. And then we have, it divides into two posterior cerebral arteries. Now, if you look at the cerebellar branches, these are the cerebellar branches of the basilar artery, supplying the cerebellum. Superior and two inferior. Two inferior, one is anterior and the other is posterior. Now, then the posterior one, posterior cerebral artery, connected to the internal carotid, as we saw, by a posterior communicating artery. It gives a posterior choroidal artery. This one supplies the choroid plexus of the third and lateral ventricles also. In that we have two choroidal arteries. One of them is a branch of the internal carotid. The other one is a branch of the posterior cerebrum. This is posterior and that's anterior choroidal artery supplying the choroid plexus. Now we have a very important point. We have three cerebral arteries, which are cerebral. Anterior cerebral, which is a branch of the internal carotid. Is it a branch or a division? It's a division. And then, what is the other one? Medial, which is the other division of the cerebral. Okay? And then we have a posterior. Now, we have direct anastomosis between. When we say direct anastomosis, what do we mean? They connect together and make one vessel. So we have a posterior communicating, which is a vessel connecting the anterior carotid with the posterior cerebellum. Then we have an anterior communicating, connecting the two anterior cerebellum. This makes a circle, the circle of Willis. Point number one. Now,
Can you repeat?
I'm going to explain it in the diagram, so I will wait. Okay. But the other important point, in addition to this direct anastomosis, the cerebral arteries anastomose freely. But the anastomosis is inefficient. And what do when we say direct anastomosis, we explain it. What is indirect anastomosis? There are two types of indirect anastomosis. Anastomosis at the level of capillaries. So we have capillaries of one vessel, making one network with the capillaries of the other vessel, or they share the area. So it is just the diffusion from the capillaries of one vessel share an area with the diffusion from capillaries from another vessel. When we have such an instance, we call this a watershed area. Watershed means they do not communicate as vessels, but they share the area they supply through diffusion. And this exists a lot in the brain. We have lots of watershed areas. I'm going to explain again because they can create issues. So the anastomose freely through all three different types of anastomosis are seen in the cerebral circulation, but mostly this watershed area concept. I will explain it when I reach it. Now, this is the, the circle of Willy. This is the circle of Willy. Although not very accurate at the lower part of it. This is posterior cerebral, and this is posterior communicating between the posterior cerebral and the internal carotid. This is the anterior cerebral, and this is the anterior communicating between the two anterior cerebral arteries. Now this is a circle now. As you can see, the middle is not part of the circle. The middle is not part of the circle. This is the circle. And I said this is not accurate because this is supposed to be communicating the branch, not the basilar. Communicating the posterior cerebral with the internal carotid. Another one which is better. Now this is the posterior cerebral artery supplying the inferior surface of the temporal and occipital, but also it goes, as you can see, for the occipital, the branches hook around to the lateral surface. So the lateral surface of the occipital lobe is also supplied by the posterior cerebral artery. Now, these vessels of the cerebral circulation have two types of blood vessels, branches. Can you remind me of the branches of the basilar artery?
Superior cerebral.
There are cerebellar branches, okay, superior and inferior, okay, and then penetrating, and then we have circumferential, other than the cerebellum, hooking around, supplying the surface. Now, penetrating arteries go for the gray matter on the inside, while circumferential and cerebellar arteries supply the surface. Cerebellars supply the surface and the internal structure. Now, why am I mentioning this? Because in the cerebral circulation, blood vessels can supply the cortex, and we call them cortical branches. And we also have penetrating, the same, to penetrate to supply the interior of the cerebrum. So we have two types of vessels. These cortical ones, all three cerebral arteries, they have branches, and with their veins are all found in the subarachnoid space, and this is a very important piece of information. When they bleed in the subarachnoid space. And the subarachnoid space is some sort of open. It's open. Blood flows freely. And I mentioned earlier the balance between the brain tissue, the CSF, and the blood is very crucial. If this blood leaks, then we will have a buildup of intracranial pressure. And this is dangerous for the brain tissue. A buildup. So the most dangerous type of hemorrhage is subarachnoid. Why? Because the space is open and blood oozes very quickly from the arteries, and very quickly there is a buildup of intracranial pressure that leads to problems, leads to clinical problems. So they are found in the subarachnoid space. Now they give cortical branches, and these cortical branches leave the space and enter the brain tissue from the surface. I mentioned earlier, حددنا بس قلنا الانتيريور supplies this part and goes to cerebellum, and the medial supplies the lateral part but not the occipital, and the occipital the posterior supplies the inferior surface and the occipital. Definite areas well known, but there is separated by border zones. When we say border zone, it means shared by the terminal branches, shared, and these are called watershed areas. So other territories are separated by this watershed area. Now, what is the importance of this watershed area? If there is diminution in the pressure in the circulations, this area will be the first to be affected because there is oligemia and ischemia. Less blood, less oxygen. Maybe you will have micro-infarcts, infarctions in this watershed area because of any problems leading to oligemia and ischemia. But you need to remember these watershed areas. When you look at an MRI, you look there for micro-infarcts. Now, rupture or occlusion of a vessel affects this territory immediately. Even physiologic ischemia can affect hypotension, chronic hypotension can affect these areas immediately. Now, I mentioned this and I am repeating, like أنا قلت cerebral arteries anastomose freely, but I need to remind you that cortical branches on the inside anastomose freely, but inefficient sort of anastomose. Now, these cortical branches of the areas, you already know them, but just to reiterate, anterior cerebral supplies the anterior 2/3 of the medial surface of the cerebral hemisphere, and 2 to 3 centimeters strip of the adjoining orbital and lateral surface. This territory, because we now need to know what areas, you know them. These areas include the supplementary motor supplementary motor area, and the primary motor area and sensory areas of the contralateral lower limb. Can somebody mention these 3 again? No, I won't show them. But medial surface, what does it contain? By the way, let me give you the name. It is called the paracentral lobule. It's a lobule because it is concerned with the blood nerve supply of the lower limb, plus genitalia. So, what does it include? This paracentral. You have the central.
That's the part of the pre and the post.
The primary sensory and primary motor and supplementary motor. Primary sensory, primary motor and supplementary motor. Because they extend into the medial surface. This area is supplied by the anterior cerebral artery. فإذا عندنا supplementary motor area, primary motor area, and sensory areas of the contralateral lower limb, of the lower limb of the other side of the body. Medial cerebral, they supply 2/3 of the lateral surface of the cerebral hemisphere, the insula, and the temporal. This is which, and this you know which areas are included. They include the primary motor area, of course, the sensory areas, primary and secondary, of what? Just remove the lower limb and the genitals, the hand, the face, Broca's area, Wernicke's areas in the dominant sense. This is why when I mentioned the medial cerebral, I said it is the most important of the cerebral, medial cerebral. Now, the posterior cerebral supplies the primary and association visual areas because it supplies the occipital lobe mainly. Occipital lobe mainly. By the way, the macula is supplied by the medial. Only the macula supplied by the medial cerebral part. So look at these are the branches of the anterior cerebral coming from inside to supply This is strip, 2 to 3 centimeters strip, and this is the watershed area between the branches of the medial and the branches of the anterior. And these are the branches of the posterior supplying the whole of the occipital lobe. This is color coding of the 3 branches, showing you which areas they supply: anterior cerebral, medial cerebral on the inside, and then the posterior cerebral. And these are the areas color coded to show you. This is middle and inside, and this is strip from the anterior, and this is the strip from the posterior cerebral artery. So in the same sort of emergencies. It is not an actual circulating blood here. It does not flow regularly. But if we have blockage here, blood will come through this and supply this. And the same applies to this. If we have a problem somewhere here, then we have blood coming through the other side. So they are sort of anastomosis for emergencies. Now this is, the green one is the circle of Willi, and as you can see, the circle is an active one. This is just an illustration. Now, this anastomosis is usually not operational unless there is an obstruction somewhere. And in this case, the branch is enlarged with time. If the obstruction continues, these branches, anterior communication and posterior communication, enlarge a little bit to accommodate this side traffic. Now, the circle will really have branches. Earlier I said there are cortical branches and there are central branches, penetrating branches. Most of the branches from the circle itself are central branches. So it has branches coming from the circle, from posterior cerebral, anterior cerebral, and communicating branches. There are some central branches supplying internal structures within the cerebrum. Here you can see them. In the previous, we don't see them, but we can see these branches. These are the central branches. You see, they go inside to supply internal structures. Maybe you will not memorize them right now, but we need to mention them. They have names, and when you study them in detail, the thalamic one, the thalamus striate, the middle striate, lateral, medial and lateral striate, they have names, and geniculocalcarine, and so on. So you have, you can memorize them later. You cannot memorize them from later. Now, they arise from the main branch. And these include anterior and posterior choroidal. We already mentioned them. Where does the anterior choroidal come from? Internal choroidal. What about the posterior choroidal? Posterior and anterior choroidals, and the recurrent artery of pulmonary from the anterior cerebral. Okay? These are striate arteries, central arteries, sorry. Some of them are striate for the corpus striatum. And because the thalamus is nearby and the internal capsule is in between, they supply the internal carotid, they supply the thalamus, they supply the basal nuclei and the internal capsule. These are very important central arteries. Now, the majority of these central arteries are from the circle of Willis and the cerebral arteries. Now, some of them are short, some of them are long, and they named. Now, the short ones from all the elements I mentioned earlier, for the optic nerve, the optic chiasma, the optic tract, and the hypothalamus. These are short. Now, the long ones, mainly from cerebral arteries, supply the thalamus, internal capsule, and basal ganglia. And there are short ones for surface structures, the hypothalamus, optic nerve, chiasma, and tract, but there are deep central ones, and these supply the others. Now, those particularly for the basal nuclei are called the striate arteries, and these arteries from mainly anterior and middle cerebral arteries. They create foramina الفورامين قلناها لو تذكروا بتاع هوبنر قلنا it goes through openings سميناه the anterior perforated substance. Anterior perforated substance. Now the medial striate أكبر واحد فيهم اللي هو بتاع هوبنر دي supply the thalamus and basal ganglia and internal capsule. The largest of them. Now lateral and these come from the medial cerebral artery and anterior choroidal arteries penetrate the lentiform across the internal capsule to the surface. يعني ده medial mainly striate. لكن the lateral striate ones from the both arteries supply internal capsule in addition and the surface. Now these the striate arteries or other central arteries are true end arteries. What's an end artery? Manila, we mentioned 3 types of anastomosis. Direct, horizontal. Well, indirect 2 types. Capillary networks, no capillary networks. They don't have water shape. Either they are true end arteries. If they are blocked, the area supplied by these vessels dies. So the striate arteries are end arteries. Bleeding or occlusion of these arteries usually leads to necrosis. Just a reminder with another diagram, these are the central arteries, and this diagram I brought it because if you need to memorize the names are there. لكن الآن you can know that we have a large medial striate artery. This was a medial striate artery of Hubner. It's a branch of the anterior cerebral and all of that. The lateral are also there for the medial and anterior cerebral arteries, and they all supply. This is another diagram showing them. This central going inside, supplying the thalamus and the internal capsule and the basal nuclei. This is a side view showing the central artery supplying the structures, and this is an extraction. These are the basal nuclei and the thalamus and the capsule. Color coded, globus pallidus, etc. We have why color coded. This is very important because I am going to ask you about this in exams. This is the internal capsule, the thalamus, and the basal nuclei. Now, anterior cerebral artery supplies this area. The middle cerebral arteries supply this and the globus pallidus. Now, the anterior choroidal artery supplies the greenish area. The posterior cerebral artery supplies this area. So you need to remember this, and when we have, and they are true end arteries. When these striate arteries are blocked, you need to know exactly in the internal capsule, because, by the way, we need to plan for this lecture. It's a very important lecture. The internal structure of the cerebrum, and the internal capsule, and the divisions, and the somatotopy in the internal capsule, and all of that. So you need to know which area contains which fibers, retrolenticular optic radiation supplied by 2, and so on. This is very important at the end of all of that. And this is a softer illustration, not detailed as the previous one. Do we have time? Have 5 minutes?
Yes.
Okay. Quiz. Tanda, follow everywhere.
I can't even read the. I can't see the options.
Doctor, it's fine. We can take a picture and send it on the group and then read it. Okay,
No,
so it's
we
too
want to see the
small.
I can read it. Where is the question? Which of the following statements about the blood supply of the brain is true? The brain receives its blood supply directly from the 2 external carotid arteries. Okay, the posterior communicating arteries form part of the circle of Willi. The cerebral arteries do not anastomose on the surface of the brain. I mentioned. Huh?
Yeah, on the polish everywhere, it's which the following statement about the vascular evacuation.
Okay. Do you have this one?
Yes, we didn't get the right.
Which one? No, forget about that. Huh?
The questions are not changing.
I'm not changing. Okay. Technology issues, huh?
I think we can solve them here.
Huh?
Yes,
I know, you have the board one. You have the board one. Okay. Thank you very much.